Morning, everyone. Bonjour à tous.
Hello, everyone. These last few months have been difficult for everyone, but for certain families, these last few weeks have been particularly heartbreaking.
A few days ago, we lost 13-year-old Emily Victoria Viegas to this virus. Earlier this month, it was a toddler who hadn't yet turned 2. And tragically, they're not the only children who've been taken by COVID-19. As a father, I know there are no words for the parents' grief. To Emily's family from Brampton, and to the family in BC, and to all parents who've lost a child, and to everyone who's lost a loved one, we are thinking of you. We are grieving with you. And you are not alone. Le virus fait déjà trop de victimes.
The virus has already taken too many victims. We must absolutely ensure that further deaths are prevented. The third wave is still growing strong, and across the country the number of cases is increasing. Hospitals and frontline workers are exhausted. Now is the time to work together. On our end, we're doing everything we can to help the provinces and territories to master the situation.
To beat back the third wave and protect Ontarians, we're deploying federal healthcare workers to the province. This mobilization includes 3 medical assistance teams and 9 critical care nurses from the Canadian Armed Forces. Yesterday, the forces carried out their assessment of the needs on the ground in Ontario to finalize the details of this operation. We're working with our provincial partners on next steps, and Armed Forces members will be mobilized in the coming days. Let's be clear. Sending men and women in uniform to help in Ontario is a serious step. We're doing this because the situation requires it. Today, the first deployment of nurses and doctors from Newfoundland and Labrador will also be arriving in Ontario for the GTA. They'll land this afternoon at Pearson aboard a Canadian Armed Forces airplane. Newfoundland and Labrador is already organizing a second team of healthcare workers who will rotate in to help. Our government is covering the costs of deploying these teams, and we're ready to do the same for any other province or territory that can also step in with support. Unfortunately, Ontario is far from the only place dealing with a spike in cases. Across Nova Scotia, and especially in the Halifax region, numbers have risen quickly, and the province requested help. So we're sending support. We're deploying 60 Canadian Armed Forces members to testing centres in Nova Scotia. This will help stop the spread of the virus. For Albertans, too, we're standing ready. Over the weekend, the regional municipality of Wood Buffalo, which includes Fort McMurray, declared a state of emergency. Yesterday, Minister Hajdu talked to Mayor Scott about the outbreak in the region and the situation on the ground. Our government has reached out to Alberta on what support they may need to keep people safe and get the situation back under control. The bottom line is this. Across the country, we're working with provinces and territories to keep you safe. Across the country, we will have your back. And together, we will get through this. That brings me to vaccines. Because along with public health measures, these doses are key to beating not only the third wave, but the whole pandemic. This week, we'll get almost 2 million doses delivered to Canada. This includes our first shipment of the Janssen vaccine from Johnson & Johnson. Looking ahead, Pfizer alone will deliver 2 million doses a week starting next week, and will continue to work hard with manufacturers to deliver a stable and growing supply of doses to provinces and territories as they plan vaccination clinics. When it's your turn, make sure you book an appointment to get your shot. Sophie and I got our first doses of AstraZeneca on Friday. We're feeling great, we're feeling more protected, and we're also feeling like we're part of the solution going forward. I want to take a moment to do something I don't often do from this stage. I regularly are talking about our seniors and our young people. I want to take a moment to talk about my generation. Over the past number of days, we've seen vaccines made available to people 40 years old and up, and that means Generation X has stepped up and stepped out to get vaccinated. And I want to thank everyone who's been stepping forward and signing up and enthusiastically moving forward. Keep it up. Because of the high uptake, because of everything everyone's doing to get more doses into Canada and into arms, we're now second in the G20 in terms of vaccination doses, and we're going to continue. So thank you to everyone for doing their part. D'un bout à l'autre du pays, les infirmières, les médecins, les pharmaciens et le personnel paramédical travaillent jour et nuit
are working day and night to ensure that the largest number of people possible is vaccinated as quickly as possible. To everyone who is helping with the vaccination effort, thank you. You're doing incredible work. We're working non-stop to provide you with as many vaccines as possible.
Si on regarde le taux d'administration des vaccins, c'est-à-dire le nombre de doses administrées par jour par rapport à la
that is the number of daily doses administered to the population, Canada regularly places second among G20 countries.
Et d'assurer votre protection et celle de votre famille et d'en finir avec la pandémie le plus rapidement possible. La lutte contre la pandémie est notre priorité absolue. Et pour arriver à vaincre ce virus, il faudra l'éliminer partout.
We've all seen the heartbreaking news from hospitals in India that are unable to keep up with the number of patients. Earlier today, Minister Garneau spoke with his Indian counterpart about how Canada can best help, including through the donation of extra medical supplies. We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally. If you want to donate to the emergency efforts on the ground, go to redcross.ca. I know many Canadians are also concerned about rising cases in Pakistan. Minister Garneau will be speaking to his counterpart from Pakistan later today about the situation and what we can do to help. As a world, we are in this fight together. On espère qu'on est à la dernière phase de cette pandémie. C'est pour ça qu'on doit tenir bon et se protéger les uns les autres un peu plus longtemps. Chaque fois qu'on garde nos distances et qu'on porte un masque, on se rapproche des jours meilleurs qui nous attendent, quand on pourra manger entre amis sur une terrasse ou organiser un grand barbecue familial dans la cour arrière. Et pendant qu'on continue nos efforts,
And while we continue our efforts, we need to make sure that people can not only get through the storm, but come back stronger.
As we face a she-cession, a recession that disproportionately affects women, we cannot allow anyone to get left behind. That's why, a week ago, we introduced our progressive feminist plan for recovery. So what does that mean for people's lives? Well, for women entrepreneurs, it means almost $147 million to help with financing, mentorship, and training. This is about investing in the kind of entrepreneurs Minister McMurray will sit down with today from BC, and the Deputy Prime Minister will speak to from the 51 in Alberta. I know Minister Monsef will also be speaking with women-owned businesses from Toronto about what they need to thrive too. Women-led small businesses strengthen communities and are the backbone of our economy. For mothers, this plan means making sure you have good, affordable childcare to balance work and kids. And I know this will come up when Minister Gould speaks to women business owners from Windsor about our plan to reach $10 a day daycare across the country in the next 5 years. Pour toutes les femmes, dans toutes les régions du pays, il faut adopter un plan féministe et progressiste pour l'avenir qui vise à assurer la sécurité de tous. C'est pourquoi on va de l'avant avec le tout premier plan d'action national pour mettre fin à la violence fondée sur le sexe. Plus tôt aujourd'hui, la ministre Bibeau ainsi que les députés Brière et Bessette ont rencontré différents groupes de cantons de l'Est pour discuter de notre plan et des manières d'assurer la sécurité de tout le monde. La dernière année a été très difficile. Que vous soyez parents, propriétaires d'une petite entreprise, étudiants ou personnes âgées. Mais de meilleurs jours nous attendent.
But better
Et grâce
days
à notre
are
plan,
still to
on
come.
va créer de bons
And thanks
emplois
to
pour
our
la classe
plan,
moyenne,
we're going to create
rebâtir
good
une
jobs for the
économie
middle
propre
class,
et
build
résiliente,
back a
et
clean,
bâtir un
resilient
Canada
economy,
plus juste
and make a
pour tout le
fairer
monde.
Canada for everyone.
Merci.
Thank
Je suis
you.
maintenant heureux de passer
And
la
I'll now
parole au
pass the
ministre
floor
Blair.
to Minister Blair. Bill, you have the floor.
Thank you very much, Prime Minister, and good morning, everyone. As the Prime Minister mentioned, in response to a request for assistance received from the province of Ontario, we've been working with the Canadian Armed Forces, the Canadian Red Cross, and medical personnel from Newfoundland and Labrador in order to help fight COVID-19 in Ontario. We have today identified 62 health human resources from federal departments across the country who have been identified as potential volunteers to be deployed to Ontario. The Canadian Armed Forces is also deploying 9 ICU nurses and up to 3 multi-purpose medical assistance teams. In addition, the Canadian Red Cross is prepared to deploy an initial group of 13 nurses with ICU and emergency response experience, and they are prepared to deploy up to 30 additional resources. And finally, as the Prime Minister mentioned, today 6 nurses and 3 physicians from Newfoundland have begun to travel to Ontario in order to provide much needed help, and that will increase up to 14 nurses in the coming weeks. And at the same time, we are working with the province of Nova Scotia to help them fight back rising numbers of COVID cases. And we have approved today an RFA, a request for assistance from the province of Nova Scotia. And we will be deploying 60 Canadian Armed Forces members to testing centers in that province. Over the past year, there have been 70 requests for assistance received from the provinces and territories, including 22 from the province of Ontario. In every instance, we have worked with our provincial and territorial partners, and we have marshaled our resources to help out. And for example, we have provided resources to help our seniors in long-term care homes. We have provided assistance to support temporary foreign workers in safe isolation sites and who come to this country to help Canadian farmers. We have been assisted in responding to hotspots with mobile health units, and we have been working in remote communities and Indigenous communities across the country to boost capacity in those communities. We will continue to work with the Canadian Armed Forces, the Canadian Red Cross, and our partners in every province and territory to continue this fight. And we will work collaboratively with our provincial and territorial partners. And as we do this important work, I want to urge all Canadians, follow the public health guidelines, wear your mask, and get your vaccine as soon as you are eligible. It's only by working together that we can beat this. Thank you very much.
Dr. Tan?
Good afternoon and bonjour à toutes et à tous. This week is National Immunization Awareness Week in Canada. And across generations, Canadians are recognizing the importance of vaccination for saving lives and preserving health, well-being, and livelihoods. First, we'll update the numbers, then focus on the importance of vaccines among other public health measures to control serious infectious diseases. To date, close to 1,190,000 cases of COVID-19, including over 24,000 deaths, have been reported in Canada. And over the past week, a somewhat lower average of just over 8,000 cases were reported daily, while the number of people experiencing severe and critical illness continued to rise. On average, over 4,300 people with COVID-19 were being treated in our hospitals each day, including 1,350 people being treated in intensive care units, representing over 15% increases compared to the prior week. At the same time, an average of 51 deaths were reported daily, which is also 15% higher than the week prior. There are over 94,200 variants of concern cases reported to date across Canada, with the B117 variant accounting for 96% of these. A year ago, during National Immunization Awareness Week, we talked about how vaccines played a significant role in preventing and controlling the spread of serious, life-altering, and sometimes fatal diseases like measles, pertussis, influenza, diphtheria, and polio in Canada and around the world. We ended by saying a vaccine may also one day be available to prevent and control the spread of COVID-19. So what a difference a year makes. And not only do we have many examples of the life-saving benefits of vaccines across the infectious diseases landscape, but wherever COVID-19 vaccines have been rolled out, we're starting to see what a difference they make. In fact, prior to the pandemic, vaccines were credited for saving 2 to 3 million lives each year. Now, with over 3 million reported deaths due to COVID-19 worldwide, it is clear that these safe and highly effective vaccines have a big role to play in ending the pandemic and averting millions more deaths. And the benefits of COVID-19 vaccines are increasingly being seen in Canada as well. For example, thanks to Indigenous leadership on a range of public health measures and on the early deployment of vaccines supported by all levels of public health and the Canadian Armed Forces, over 340,000 vaccine doses have been administered in over 650 Indigenous and territorial communities. With increasing vaccine uptake, active COVID-19 cases have dropped more than 80% in First Nations communities in the past 3 months. It is enormously encouraging to see how vaccination is serving to protect higher risk communities. Similar benefits have been seen in other high-risk populations targeted for priority vaccination. With vaccines rollout expanding every day, we can expect to see these benefits across the Canadian population. Vaccines are an incredibly important public health tool throughout our lifespan, from protecting children against serious and life-threatening infections to preserving and prolonging health and well-being into our senior years. But when it comes to tackling a pandemic with widespread and elevated levels of risk, we must maintain other vital public health measures to bring the infection rate down and keep it down as vaccines roll out across the population. That means keeping up with individual precautions and public health measures in your area until we've built the bridge for vaccines to take us to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. Cette
Hello,
semaine est la
everyone.
Semaine nationale de
This
promotion de
week
la
is National
vaccination au
Immunization
Canada.
Awareness Week in
Toutes
Canada.
générations confondues,
Across
les Canadiens
generations,
reconnaissent
Canadians are
l'importance de la
recognizing
vaccination pour sauver
the
des vies
importance
et
of
préserver la
vaccination for
santé,
saving
le
lives and
bien-être
preserving
et les
health,
moyens de
well-being, and
subsistance.
livelihoods.
Nous ferons d'abord le point
First,
sur les
we'll update
chiffres,
the numbers,
puis nous nous
then
concentrerons
focus
sur
on the
l'importance
importance of
des vaccins
vaccines,
parmi
among
d'autres
other
mesures de
public
santé
health
publique
measures, to
visant à
control
contrôler les maladies
serious
infectieuses
infectious
graves.
diseases.
À ce jour,
To
près de
date, close to 1,190,000
COVID-19,
cases
dont
of
plus de 24
COVID-19,
000 décès ont
including
été
over
recensés au Canada.
24,000
Au cours de la
deaths,
dernière
have been
semaine,
reported
une
in
moyenne
Canada.
légèrement
Over the
inférieure
past
d'un
week,
peu
a
plus de
somewhat
8
lower
000 cas
average
a
of just
été
over
signalé chaque
8,000
jour,
cases were
tandis que le
reported
nombre de
daily,
cas graves et
while the number of
critiques a
people
continué
experiencing
de croître.
severe and critical
En
illness
moyenne, plus
continued
de
to
4
rise.
300 personnes
On
atteintes de
average,
la
over
COVID-19 ont
4,300
été
people
traitées
with
dans nos hôpitaux
COVID-19
chaque
were
jour,
being treated
dont
in our
1
hospitals each day.
350 personnes
This
étaient
includes
traitées dans des unités de soins
1,350 people
intensifs,
being
ce qui
treated in
correspond à
intensive
des
care units,
augmentations de plus de
representing
15% par
over
rapport à la semaine
15%
précédente. Au cours
increases
de la même
compared to the
période,
prior week.
en moyenne,
At the same
51
time,
décès ont été
an average of
recensés chaque
51
jour,
deaths were reported
représentant
daily.
également
That is
15%
also
de plus
15%
que la
higher
semaine
than the
précédente.
previous week.
Nous enregistrons
There are
plus
over
de 94 200 cas
94,200
de variants
variant of concern
préoccupants à ce
cases
jour au Canada.
reported to date
Le
across
variant
Canada.
B117
The
représente
B117 variant
96%
accounts for
de ceux-ci.
96% of
Il y a
these.
un an, à l'occasion de la
A
Semaine
year ago,
nationale de
during
promotion de
National
la
Immunization
vaccination,
Awareness
nous
Week,
avons
we
expliqué le
talked
rôle
about how
important des
vaccines
vaccins
play a
dans la
significant
prévention et
role
le
in
contrôle
Canada
de la
and around the
propagation des
world
maladies graves
in
qui
preventing and
changent les vies
controlling
et
the
sont
spread
parfois
of
mortelles,
serious,
comme la rougeole,
life-altering,
la
and sometimes
coqueluche,
fatal
la grippe,
diseases
la
such
diphtérie
as
et la
measles,
polio, au
pertussis,
Canada et dans le
influenza,
monde entier.
diphtheria,
Nous avons
and
terminé
polio.
en disant
We
qu'un vaccin
ended by
pourrait
saying
aussi être
a
disponible
vaccine
un
may
jour
also
pour
one day
prévenir et
be
contrôler la
available to
propagation
prevent and
de la
control the spread
COVID-19.
of COVID-19.
Quelle différence en
What a
un
difference
an!
a year
Et
makes.
non seulement nous avons un
Not
grand nombre
only do we have
d'exemples
many
des avantages
examples of the
vitaux des
life-saving
vaccins dans le
benefits
domaine
of
des maladies
vaccines
infectieuses,
across the
mais
infectious
partout où les
diseases
vaccins contre la
landscape,
COVID-19
but
ont
wherever
été administrés,
COVID-19
la
vaccines have been
situation
rolled out,
commence à changer.
we are starting to
En
say
fait,
what a
avant la
difference they
pandémie,
make.
on
In
attribuait aux
fact,
vaccins
prior to
le
the
mérite de
pandemic,
sauver de 2
vaccines were
à 3
credited for
millions de
saving
vies
2 to
chaque
3
année.
million lives each
Alors,
year.
nous
Now,
recensons aujourd'hui plus de
with
3
over
millions de
3
décès
million reported deaths
attribuables à
due
la
to
COVID-19
COVID-19
dans le
worldwide,
monde
It is clear these safe and highly effective vaccines have a big role to play in ending the pandemic and averting more deaths.
Et à éviter des millions de décès supplémentaires. Nous pouvons bénéficier de plus en plus des
The
avantages
benefits
de
of COVID-19 vaccines are increasingly being seen in Canada as well. For example, thanks to Indigenous leadership on a range of public health measures and the early deployment of vaccines supported by all levels of public health and the Canadian Armed Forces, over 340,000 vaccine doses have been administered in over 650 Indigenous and territorial communities. With increasing vaccine uptake, active COVID-19 cases have dropped more than 80% in First Nation communities in the past 3 months. It is enormously encouraging to see how vaccination is serving to protect higher-risk communities. Similar benefits have been seen in other high-risk populations targeted for priority vaccination. With vaccine rollout expanding every day, we can expect to see these benefits across the Canadian population. Vaccines are an incredibly important public health tool throughout our lifespan, from protecting children against serious and life-threatening infections to preserving and prolonging health and well-being into our senior years. But when it comes to tackling a pandemic with widespread and elevated levels of disease, we must maintain other vital public health measures to bring the infection rate down and keep it down as vaccines roll out across the population. That means keeping up with individual precautions and public health measures in your area until we've built the bridge for vaccines to take us to greater safety and back to the things we have missed so much. Thank you.
Merci, Dr. Neal. Le Premier ministre prendra 6 questions, commençons par le téléphone. Une question, une sous-question. Les ministres et docteurs demeureront disponibles pour 15 minutes par la suite. Thank you. The Prime Minister will take 6 questions today, starting with the phone. Ministers and doctors will remain available for another 15 minutes after. Opérateur, c'est à vous.
Thank you, merci. Please press star 1 if you have a question. S'il vous plaît, appuyez sur étoile 1 si vous avez une question. The first question is from Tanda McCharles from the Toronto Star. Please go ahead.
Yes, good morning, Prime Minister. I'd like to hear your response to Ontario's request for the federal government to double sick leave benefits, and they would reimburse you for the extra $500. Will you do that? Will you do that for Ontario, and will you do that deal for all provinces?
Thank you, Tonda. First of all, as we see the news from Ontario and across the country in places affected by this third wave, our heart goes out to the families facing tragedies, the essential workers in workplaces who are worried about bringing home the virus, who are continuing to need to go to work. This is one of the reasons we brought in a federal sick leave program that individuals could directly apply for many months ago. We know that it's an important piece of the puzzle. At the same time, the Deputy Prime Minister and Finance Minister is engaged directly with the province of Ontario to support them as they look at further measures to ensure that nobody has to make the choice of going to work sick. One of the most efficient ways of doing that is obviously to work through employers, as we have through federally regulated workplaces. And I know the Deputy Prime Minister is working directly with the province of Ontario to ensure that the right supports get there for people as quickly as possible. As we've said, we are there to help Canadians. We have people's backs. We need to work together, and provinces need to look at the way to deliver sick leave directly through employers, which the federal government can't do.
Following up, Tanda?
Yeah, thank you. That actually sounds like a no to Ottawa tweaking its system to deliver the benefit and getting a reimbursement from the province. And if I'm wrong on interpreting the last sentence there that way, please correct me. But you did say in your prepared remarks about, the federal government wants to tell parents like Emily Viega's parent, that they're not alone, but many of them do, especially essential workers, do feel alone in all of this. So if the Ford government says to you the best way to do this is for you guys to cut the check and they reimburse you, why wouldn't you do that?
First of all, the Deputy Prime Minister is engaged directly in conversations with the appropriate authorities and officials in Ontario, and she is engaged on that. I know she's put out a statement earlier this morning, and she is very much the lead on this in terms of making sure that we are there to support Ontario in getting this help to Canadians the right way as quickly as possible. That's what we all want on this, and we need to make sure we're using the right tools, and I have tremendous confidence in the Finance Minister to stick handle this and make sure that we are getting that support to people. Like I've said, from the very beginning of this pandemic, federal government made a promise to have people's backs through this as much as it takes, as long as it takes. That's why 8 out of every $10 in pandemic support across this country came from the federal government. We will continue to look at every way we can support the provinces as they do what they need to do to keep people in their jurisdictions safe. We are there to support in any way that will work. And that's what the Finance Minister is working on right now with Ontario.
Thank you. Operator, next question on the phone.
La prochaine question est de Marie Vastel, Le Devoir. La parole est à vous.
Marie Vastel from The Devoir.
Oui, bonjour, M. Trudeau. J'aimerais revenir sur cette annonce de
Prime
l'Union
Minister,
européenne
I'd like to go back to the European Union's announcement that Americans who are fully vaccinated will be able to visit the EU this summer. I asked you this same question concerning Canada a few weeks ago. What are your thoughts now? I understand that this is not the time to travel. You don't need to repeat that in your answer. But there are perhaps tourists who would like to come back to Canada to see family members once the rules have been loosened. Once they have received 1 or 2 doses of the vaccination. What about tourists from the U.S. who'd like to come this summer? Answer. A year ago, we took the necessary the unprecedented measure of closing our border to tourists. I know this had an impact on the tourists and their plans, as well as a major impact on small businesses and regions across the country. They really face difficulty because of this. We took this decision, however, because we have to protect Canadians from this virus. That's our priority. And other measures, quarantines, multiple rapid tests, shutting down flights. These other measures have also been taken based on science at every stage. The goal has always been to protect citizens. Scientists and other experts are currently closely watching the impact of full vaccination on the ability of the virus to spread. Once the time is right, we will open up the borders again properly, perhaps with necessary vaccination certificates. But as you said, we're not yet at this point. We need to ensure that when the time comes, we do things right to continue to ensure that Canadians are safe. Follow-up question? Yes, but when do you think you'll have answers to these questions? I understand that not all Canadians are vaccinated yet, but there are other countries where they have been. All citizens have been vaccinated. And concerning the AstraZeneca doses that Canadians are willing to, that rather Americans are willing to share with other countries, do you know if Canada will be a beneficiary of this generosity? When will we receive these
D'abord,
vaccines?
encore une fois,
Answer.
nous sommes
Once
en
again,
train de regarder la situation, mais nous
we're
sommes en
currently
pleine
examining the
troisième vague
situation,
maintenant et notre
but we're right
priorité,
in the middle of the
c'est sur
third
la
wave.
sécurité des
Our
Canadiens
priority
maintenant.
is
Oui,
the safety
on
of
prépare
Canadians
des
now.
plans pour des ouvertures
We're
éventuellement,
preparing
mais c'est trop tôt
plans
pour
to
parler
eventually
de
open up
quand et
again,
comment
but it's too early to
quelles
talk
seront les
about when
modalités.
and how.
Nous nous concentrons sur cette
Right now, we're
troisième
just
et on
concentrating on
l'espère
this third wave,
dernière vague de cette
and
pandémie
we
et
hope
c'est
it will
pour
be
ça
the
que les
last
gens doivent
one.
tenir bon. Par
That's
rapport
why
aux
people need to
conversations
hang
avec
in
les
for a little
Américains,
longer.
j'ai eu un très bon
As for
appel avec le
conversations
président
with
Biden
the
la semaine
American
passée.
administration,
Nous
I had a
sommes
very
en
good
train de
conversation
leur
with
parler
President
régulièrement et
Biden
on
last
espère avoir
week.
des nouvelles
We are
bientôt.
in touch on a
Mais je
regular
pourrais peut-être
basis. I
passer à la
hope to have
ministre
news soon,
Anand pour
but
ajouter
perhaps I
quelque
can
chose, mais
ask
pour
Minister
l'instant, on
Anand
n'a
to
rien à
follow up
annoncer tout de suite.
and add her own
Anita,
comments.
anything to add?
Bien sûr, Monsieur le Premier ministre,
Of course, Prime
nous
Minister,
continuons à
we are
travailler en
continuing
étroite
to work in
collaboration
close
avec
collaboration
l'administration Biden.
with the Biden
Et je suis
administration.
en contact avec mon homologue là,
I'm in
Jeffrey
touch with
Sines,
Jeffrey
ainsi
Sines, my
qu'avec
American
notre
counterpart,
ambassadrice Kirsten Hillman
as well
aussi.
as Kirsten Hillen,
Nous avons
our
déjà
ambassador to
reçu
the U.S.
1,5 million de doses d'AstraZeneca, comme vous savez, via
We have
les
already
États-Unis
received
en
5 million
mars,
doses of
grâce à
AstraZeneca
notre
from the U.S.
accord
in March, thanks to
existant
our
pour 20 millions de doses
agreement
du vaccin.
for
Nous avons
20 million
hâte de
doses of the
mettre les
vaccine.
Canadiens au
We're
courant
eager
dès qu'il y aura des détails
to keep
supplémentaires à partager. Et
Canadians
nous
up to
avons
date. As soon as
eu
we
une
have more
conversation
information, we'll
avec
let
les
them know.
États-Unis hier et
I just
nous
spoke to the
voulons
American
partager
administration yesterday
l'information
again,
certaine quand nous avons cette
and we will
information.
give
Merci
you the
beaucoup.
information as soon as we have it.
Merci. Opérateur, dernière question au téléphone.
Last phone question, please, operator.
Thank you, merci. The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, good morning, sir. You're announcing today more supports headed to the provinces in a variety of ways, but you've offered the provinces rapid tests that have gone unused. You've offered them a drug treatment from Abcellera that went unused, and you've offered them support from Statistics Canada for contact tracing, which is largely going unused. Are you concerned that some of these supports that you roll out actually don't get used by the provinces?
Our job as a federal government is to be there with the supports that are needed, and that's what we have continued to do. We respect provincial jurisdiction and provincial decision-making, but every step of the way, we will work to fulfill the promises we have made to Canadians about having their backs, and that's exactly what we've done. So whether it's, as you list, rapid tests, contact tracing resources, further supports across the country, we will continue to do that. And it's, I think I can turn to Bill Blair right now to highlight some of the further efforts and the conversations going on with the provinces as we speak to ensure that they use all the help that we are offering them. Bill.
Minister Blair?
I'm sorry, I was on mute there. We maintain a government operations center, which has the responsibility for the federal government of collaborating and working very closely with all of our provincial and territorial counterparts. And so there is a daily discussion going on between our two orders of government on how we can support each other, the very, very careful monitoring of the emerging situation in each of the provinces. And you know, I think it's also fair to acknowledge that some of the provinces have had very different requirements of the government, and that's why we also respond as quickly as possible, as I've said over 70 times now, to requests for assistance received from the provinces. There are consistencies in some of those requests, but each of the provinces has unique needs, and we respond as they require.
Thank you. Following up, Ryan?
Yeah, sir. In the case of the rapid tests, the government has paid over $1 billion for the rapid tests that it's ordered so far. And like I said, many of them haven't been used. The Abcellera treatment cost your government $40 million, and it's largely gone unused. Do you think there was a breakdown in the communication between you and the provinces in terms of buying a lot of equipment that isn't being used?
We have continued to reach out to ensure that we have all the potential equipment that we need, all the potential materials. The announcement we made last week about potential vaccine boosters for the coming number of years is another example of how we would much rather be ready and prepared with equipment that doesn't get used as much as we might have worried that it would be needed, rather than not have equipment ready in cases where it is needed. One of the things we've done consistently is on rapid tests, reached out not just to provinces, but directly to municipalities, to large employers, and to pharmacies, and a range of partners across the country to ensure that they also have opportunities to avail themselves of the rapid tests as an extra screening capacity to make sure we get this virus under control. The federal government has pulled out all the stops, and we will continue to make sure that we're doing everything we can to get through this as quickly as possible. Because it's not just about saving lives and making sure our lives get back to normal as quickly as possible. It's also about knowing that investments that we can make that will bring our economy back quicker will be good for everyone as well, and are more than worth it.
Merci. On va maintenant passer à les
Prime
questions.
Minister, I might just add something, if I could, to that response. And that is that we don't know what stages and phases the pandemic is going to take in any given situation. And that is why at the beginning of the pandemic, when we ordered PPE, when we ordered rapid tests, we made sure to put into place long-term contracts to prepare for any eventuality. And indeed, those contracts are continuing to be useful in terms of the deliveries that have continued to arrive over time. One key example is on ventilators. We put into place contracts for the supply of ventilators early on in the pandemic last spring. And we are seeing now a rise in the use of ventilators because Canada is in the middle of a third wave. Therefore, as the Prime Minister mentioned, it is so very important for us to be prepared across the board, across the various categories of PPE and supplies, so that we can stand ready via the Public Health Agency of Canada to support the provinces and territories in terms of whatever requests they are putting forward, including on rapid tests. Thank you.
Merci. Juste un petit rappel avant de passer aux questions dans la salle au ministre d'aller voter. Just a little reminder for ministers to go vote, and the PM will continue to take questions. Monsieur Blouin.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada.
Did Ryan not get a follow-up?
From Radio-Canada.
Oh, you did? Okay, sorry.
M. Trudeau, il y a des délais dans le traitement des tests de dépistage pour les gens qui sont en quarantaine. Il y a des voyageurs, des travailleurs temporaires qui, dans certains cas, doivent attendre jusqu'à 26 jours pour avoir le résultat de test qui est fait à peu près 10 jours après le début de la quarantaine. Comment pouvez-vous expliquer ces délais-là? C'est votre gouvernement qui est en charge de ça. Qu'est-ce que vous allez faire pour essayer de résorber la situation? Peut-être dans quel délai?
Je suis très préoccupé par cette situation. On est en train de changer l'échéancier du test de dépistage mi-quarantaine d'être au jour 8 pour avoir les réponses plus rapidement, les résultats plus
when you have a rapid test if you're under quarantine to day 8 instead of day 10, which it has been previously. At the same time, I'm also asked my team and the ministers to look very closely at what's going on with the companies who process the results of the rapid tests. I'm very concerned about this question.
We are very concerned about the situations reported on testing delays and result delays that are having an impact on Canadians in quarantine, and indeed on temporary agricultural workers, amongst others. We are moving the date of the day 10 test to day 8 now to allow for earlier results while people are in quarantine. But I've also asked officials and ministers to look very carefully at the contract awarded in this case of providing testing services and ensure that we are fixing this situation that is very troubling.
Hi, Prime Minister Tom Perry with CBC. On India, you're obviously giving some aid to India at this point. Is there more that you could be doing, though? I'm thinking oxygen, I'm thinking ventilators. And do you need to get a formal request from India before you can move ahead with anything like that? Where does that stand?
As I said, Minister Garneau, our Foreign Affairs Minister, has had direct conversations with his Indian counterpart. He will be speaking with the Foreign Affairs Minister of Pakistan later today. We are there to support in any ways we can. And those conversations are very much ongoing. It's something that Canadians are extremely concerned about as we see the terrible and tragic images coming out of India. We know that we need to be there for our friends, and indeed we need to be there for everyone around the world, because we don't get through this pandemic anywhere until we get through it everywhere.
And just on India also, we are across government with, as Prime Minister said, with Minister Garneau and Minister Gould and I have been coordinating to ensure that we are mounting as much assistance as possible that we can work from Canada to India. And in that regard, I have been in touch with Nadir Patel, our High Commissioner in India, as well as Ajay Basaria, India's High Commissioner in Canada, to ascertain the precise supplies that are needed in India and how best Canada can support the needs that India clearly has and that we clearly want to lend a hand with. Thank you.
Good morning, or good afternoon, Prime Minister. Theresa Wright with the Canadian Press. The United States has said it will share up to 60 million doses of AstraZeneca with the world once it clears its federal safety reviews. Given that you keep saying Canada expects to have more than enough doses in the coming months, does Canada plan to accept these doses from the United States? Do we have enough or do we not?
Those conversations are obviously ongoing. I had a good conversation with President Biden last week on this and other topics. Canada is positioned to receive close to 50 million doses of vaccine before the end of June. So it is all a question of timing. We know that we have capacity to deliver vaccines immediately into more arms as we can get more vaccine doses into Canada. So we are continuing to work every single day to try and get those doses into Canada to increase our capacity on vaccination. And indeed, it is not about taking vaccines from the rest of the world, because we have such significant contracts for all the major vaccines that are out there right now. It is a question of simply moving up timings and exchanging doses so we can get through our vaccination quicker and all the quicker turn to supporting people around the world. Nous attendions à recevoir plus de 50 millions de doses de vaccins d'ici la fin juin. Alors effectivement, nous allons recevoir beaucoup de vaccins. Nous allons avoir tout le monde vacciné avant la fin septembre. Ça, c'est promis. En même temps, nous savons que de recevoir des doses plus rapidement va nous permettre de passer à travers plus rapidement et de tourner notre regard vers l'aide aux autres pays dans le monde le plus rapidement possible. Donc, nous allons continuer de travailler pour avoir des doses plus rapidement au Canada pour pouvoir passer à travers.
Minister, it's Annie Bergeron-Oliver with CTV National News. I just want to follow up on the idea of a vaccine certificate. You just mentioned that the government is considering it, but they're not quite there yet. Based on your own timeline, though, we're only about 5 months out from having every Canadian adult who wants a vaccine to be able to be fully vaccinated. That timeline you've mentioned is end of September. So if the EU and the US move forward with this idea of having a vaccine certificate, won't those fully vaccinated Canadians be at a disadvantage? And when that border does reopen, are you anticipating having every single traveler who comes to Canada, will there be a requirement to make them fully vaccinated?
We are, of course, looking very, very carefully at this issue, even as we are in the third wave right now, dealing with extremely urgent and difficult situations. We continue to plan for how we reopen the economy, how we reopen our borders, how we get back to normal, which is something that all Canadians want to do. And obviously, as was the case pre-pandemic, certificates of vaccination are a part of international travel to certain regions and are naturally to be expected when it comes to this pandemic and the coronavirus. How we actually roll that out in alignment with partners and allies around the world is something that we're working on right now to coordinate. I can assure you that our decisions will be based on science, and the fact that those decisions are ongoing and those discussions are ongoing right now means that we will be aligned with our partners around the world.
Sounds like a yes, it will likely happen.
We are working on it on a scientific basis, and we will have more to announce when we have to announce. Right now, we're focused on getting through this pandemic and being prepared to come roaring back once we're through it. Okay. Évidemment, les certificats de vaccination font déjà depuis longtemps
Obviously, vaccine certificates have been part of the international travel regime for a long time. We'll be working with our partners in Europe, in the US, and across the world to decide upon measures and how travelers, what to do with travelers, if they're vaccinated or not. We're not at that point yet. We still have a lot to do to get through this third wave. This will require a lot of coordination. Here in Canada, we would want to reach a consensus that is based on science. We want to ensure that what we're doing is safe for Canadians.
Global National. It seems like the list of people who knew about concerns about General Vance in your government is growing longer. We had Minister Sajjan, his chief of staff, senior advisor in your office, and now we're hearing that your closest advisor, Katie Telford, knew. Should she have told you about these concerns about the top soldier in our military?
Thanks, Mike. Let me sort of first say that the situation that is faced by far too many women and men serving in our military of harassment, intimidation, assault is absolutely unacceptable. And as a government, from the very beginning, we move forward with measures to create greater support and greater recourse for anyone who comes forward from the military or from other places with concerns or allegations or experiences that they've had to survive. We will always be there to support and to ensure that those survivors are listened to and recognized for the strength and the courage that they demonstrated by coming forward in sometimes very difficult situations. When an allegation, a complaint concerning General Vance was brought forward to the minister, he forwarded it to the appropriate authorities at the PCO to follow up on it. It is not appropriate for politicians to be the ones following up on these. The minister, my office, knew there was a complaint against General Vance. Nobody knew that it was a Me Too complaint. We did not have information on what was the nature of that complaint, of that allegation. When the appropriate authorities, when the PCO received the information, they were unable to get the further information necessary on the details because the ombudsperson didn't have permission to share. Now, this highlights the situation that unfortunately is far too real for far too many people facing this, in that they don't feel like there is a process that supports them and protects them because of the strength of the culture that has allowed this for far too long within the military and within other systems. And that's why we made movements and we made investments and we made changes to the system over the past years, but it's why we need to do so much more, so much faster to ensure that anyone who comes forward with these experiences or experiences these types of harassments or assault or issues is supported and given the right resources and comfort to be able to come forward and launch a process. That is what we are focused on as a government, and that is why we will continue to be there and do everything we can, as we have from the very beginning, to support people coming forward with these sorts of experiences and allegations. Comme je dis depuis le début,
Answer repeated in French. As I've said since the very beginning, when Minister Sajjan was made aware that allegations had been made against General Vance, he worked with my office, and that information, this complaint, was sent to the authorities who are in charge of follow-up on these type of complaints. It is not appropriate for politicians to do follow-up on these types of complaints. It is the authorities whose mandate it is to do so who should be doing it. The minister knew, and my office knew that there was a complaint, but no one knew the exact specifics of that complaint, the nature of that complaint. And when the Privy Council office did follow up, it discovered that the ombudsperson could not share further information because the ombudsperson did not have permission to do so. People who have experienced these types of incidents, that is, incidents that are harmful and unacceptable in the Canadian Armed Forces, have not felt supported or sufficiently equipped.
Et c'est à ça que nous nous attaquons depuis plusieurs années, mais évidemment, nous devons d'en faire encore plus parce que c'est évident que la culture doit changer de façon radicale.
We have to fight this culture, and this is what we have been doing. We need to fight this culture within the Canadian Armed Forces, and that's what we are doing.
This is a follow-up. How disappointed are you when you hear of the allegations that these women are bringing forward and what they've been through? How disappointed are you that you didn't hear about it until this year?
As I've said, this is an issue that this government and me personally, with Katie Telford being an extraordinarily strong leader in this, we have taken seriously since day one. It's because of Katie that I have sat down with multiple women leaders within the armed forces and elsewhere to have conversations about this over the years, to look at what more can and should be done. Katie's leadership on this every step of the way is why we call ourselves a feminist government, and why we will continue to look to do more. I've been working and engaged in the issue of fighting sexual assault and harassment since my university days. And it is always extremely heart-wrenching to hear stories of people who went through horrible, horrible experiences, and then for years, and in many cases decades, had to live with that and couldn't feel like they had any recourse, had any support, could come forward and share and see consequences and see a process and see change move forward. So it's those two elements that we have to work on. We have to make sure, first and foremost, that nobody goes through unacceptable incidents of harassment, intimidation, assault in their workplace, anywhere, particularly in the Canadian Armed Forces. But also that if the unthinkable does happen, that they have recourse and support and systems there to make them feel supported and able to go through with getting accountability. This is something that we have always worked on extremely hard as a government, as a team, and we will continue to every step of the way.
Thank you, Prime Minister. This is all the time you have with us today. C'est tout le temps que vous avez avec nous aujourd'hui. On va maintenant retourner au téléphone pour les questions avec les ministres et docteurs. Opérateur, c'est à vous.
We'll now take questions for the ministers and the doctors. Operator, go ahead, please.
La prochaine question de Catherine Lévesque.
The next question is from Catherine Lévesque, Canadian Press. Go ahead, please.
Oui, bonjour à vous
Question.
tous. Bon, il y a
Hello,
une question
everyone.
que j'aurais aimé poser à M. Trudeau, mais
I
je
would
vais
have
vous la
liked to
poser
ask
à
this
vous, M.
question of
Leblanc.
Mr. Trudeau, but I'll
Il y a
ask
le
you,
ministre
Minister
de l'Intérieur ce
Leblanc.
matin qui dit qu'il est prêt à utiliser tous les outils possibles pour montrer son opposition au projet de loi là, sur le port de Montréal. Je me demandais peut-être, en tant que représentant du gouvernement, est-ce que vous craignez que le NPD
the NDP will do everything it can to prevent a special law for dock workers at the Port of Montreal to be adopted. Do you think that they will filibuster? Answer. We hope that the House of Commons will do the right thing at the right moment so that the dock workers at the Port of Montreal go back to work. As we've said, we are working with both sides of this disagreement and have been for several months. Given the consensus in Quebec and the importance of the dock workers for the Canadian economy, especially during a pandemic, federal government intervention is warranted. We know that the NDP will be against a back-to-work special law. However, as a government, we need to take responsibility for the safety of Canadians, as well as for the Canadian economy. The Canadian economy and workers across Canada, in Quebec and elsewhere across Canada who are relying on these workers. I've been at Parliament for 20 years now. I've seen the NDP at work for many years now. They resist this type of government intervention, but we don't have the luxury of being able to be idealists. We need to work instead in the interest of Canadians, and accept the responsibility, this very important responsibility.
In English, Minister Leblanc.
So in English, if I can, I as my colleagues, the Minister of Labour, the government House Leader, have indicated for many days, our government has been involved in supporting both parties in terms of the labor dispute at the Port of Montreal. We have been involved in supporting both parties in mediation efforts because we always prefer to see a negotiated settlement at the bargaining table. However, in the context of a pandemic, when so much important material for Canadians, including medical supplies, medical equipment, transit through that essential port for the economy of Canada. At one point, the government has to take its responsibility. Once the union had indicated there was going to be a general strike, we've heard the province of Quebec, we've heard Premier Legault, we've heard the business community across the country, and we've also heard from workers whose jobs depend on that important economic infrastructure for Canada functioning, and that's why we have taken our responsibility in this regard.
En suivi, Catherine?
Follow-up question?
Merci beaucoup.
Yes, please.
Pour un autre sujet, je voulais vous entendre
on another
sur une autre demande
subject,
du gouvernement de l'Ontario
I'd like to hear you on Ontario's request regarding interprovincial travel. We know that the border to Ontario is closed. However, you can still fly from Ontario to Quebec and elsewhere, and Quebec is now asking that these flights be limited. Will the federal government intervene to perhaps reduce the number of flights across the country? Answer. Thank you very much. We've been saying for a long time now that people should not be traveling. We've seen elsewhere in the country, for example, in the Northwest Territories and in the Atlantic provinces, that provincial governments have taken the necessary measures to limit interprovincial travel. Now, the reality is that my wife's son, who's a student and works in Halifax, can't travel to Moncton 2.5 hours distance to see his family. And my relatives in Montreal cannot take flights to come to New Brunswick necessarily without having first received the New Brunswick government's permission to enter the province. Of course, this is a provincial, rather a federal responsibility. The idea of closing
collègue le ministre
Provincial,
des
the
Transports
provinces,
est en train
we're always
d'examiner,
willing
par
to work
exemple,
with the
qu'est-ce qu'on
provinces.
peut faire
However,
en termes de
my
surveillance
colleague, the
accrue
Minister of
aux
Transport,
aéroports,
is seeing what
mais ce
type
sera
of
forcément
increased
un
surveillance can be
partenariat
carried
avec le
out
gouvernement de
at
l'Ontario
airports,
parce que
but obviously this would have to be
en
done
bout de
in
ligne,
partnership
c'est
with the
leur
government of
juridiction,
Ontario.
mais nous
It
serons
is
toujours
their
là
jurisdiction
pour
to
les appuyer
decide to
et nous
close
sommes toujours
your
là, évidemment, pour
borders or not.
déconseiller les
We will
gens
be there
de
for them,
voyager,
however, and we
de
are
quitter la
here to
maison
tell
pour des
people
raisons
again
non
that they
essentielles.
should not travel and not leave home,
Merci.
their homes
Opérateur,
for
prochaine
non-essential
question au
reasons.
téléphone.
Thank you, merci. The next question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning. Thanks so much for taking my questions. My first question is for Minister Anand. Fort McMurray has asked for more vaccines to help deal with its state of emergency. Will the federal government at all be increasing the vaccines that it sends to Alberta for Fort McMurray, or is it staying to the per capita distribution?
I will start off, Marika, and then I will ask Dr. Tam or Dr. New from the Public Health Agency of Canada to supplement my answer because they interface with the provinces, whereas I am more responsible for getting doses into the country. We have received 14.4 million doses to date. We've seen the provinces administer 12.4 million doses. And we now see 30% of the population in Canada having been vaccinated. We are aware that there are hotspots and there are requests for additional vaccine supplies. But as you know, at the current time, the general distribution mechanism that the provinces put in place with PHAC and the Government of Canada through an agreement remains in place, but I will ask Dr. New or Dr. Tam if they'd like to supplement that answer.
Yes, this is Teresa Tam. So I think the biggest shift in terms of support to the provinces from the vaccine front is, of course, there is an actually increase in supply coming in. So this week there'll be a increase in supply overall. So that should help Alberta. And I know that within each of the provinces, they have their strategies for targeting hotspots as they observe their own epidemiology. So that has been the strategy to date. And of course, we can have further discussions. But you can imagine, Toronto might say, well, we have hotspots. Alberta will have hotspots. British Columbia will have hotspots. And it's a complex picture. So by just increasing the supply of vaccines coming in, I think this should assist the provinces into making some of their internal decisions to reallocate as appropriately as possible. And we've seen this happen actually in many provinces where they have mobilized different vaccines to different areas of need. But that's been the strategy to date.
Following up, Marika?
Yes, thanks so much. My next question is for Minister Blair. The Prime Minister last week said that the federal government had identified up to 100 people that could be sent to Ontario. You're now saying, I believe, that it's 62. Can you please specify who those people are, why it's lower than last Friday, when they will be going to Ontario, and in addition, can you also clarify the total number of Canadian Forces members going to Ontario?
Thank you, America. As I indicated in my remarks, we've identified 62 health resources from federal departments to date. That work is ongoing, but what we've identified them, and they come from such departments. For example, we have medical personnel in Correction Services Canada, and although they have been, doing excellent work in those corrections, but we're identifying people that can be presented as potential volunteers to be deployed to Ontario. There are, within Indigenous Services Canada, within a number of federal departments, we do have some medical resources that we are seeking to deploy. So far, as I've said, 62 have been identified, but we'll continue that work. With respect to the Canadian Armed Forces in Ontario, At this point in time, we are deploying 9 ICU nurses from the Canadian Armed Forces, and as well, Ontario has asked for 3 multi-purpose medical assistance teams. I don't have a precise number, but that we'll provide that to you from the Canadian Armed Forces. We've had a number of very significant Canadian Armed Forces deployments in Ontario, and it really is based on the work that we do between our officials. The professional public service in the Government Operations Centre works with professional public service in Ontario to identify what they need, and then we work very hard to meet their requirements and requests.
Merci. On va maintenant passer aux questions dans la salle.
We'll now go to take questions from the room.
Question pour Dr. Tam et Dr. New.
For Dr. Tam and Dr. New.
J'aimerais avoir une réponse à savoir pour vous, est-ce qu'un touriste qui entre au Canada, qui a reçu ses 2 doses, est-ce que c'est un risque du point de vue sanitaire? I will repeat it in English for Dr. Tam. For you, is a tourist who has received his 2 doses who come in Canada represent a health risk?
Dr. New, est-ce que peut-être moi je peux commencer? C'est intéressant votre question.
C'est toujours une question
entre une personne individuelle. Tu as parlé d'une touriste et aussi tu en parles de la santé et la sécurité à l'échelle de la population. Je pense que Dr. Tam et moi, on a déjà précisé, on a présenté avec notre présentation, je pense, le vendredi passé, que c'est toujours un objectif, un but de vacciner le plus grand nombre de Canadiens le plus rapidement possible. Donc, on pense que si on peut atteindre une couverture vaccinale ici au Canada,
vaccine coverage that reaches 75% of the population with 1 dose,
avec 2 doses de vaccins reçus.
And then something similar with the second dose. Then we'll see what the situation is. It's not just a matter of vaccination. We know that vaccines are not 100% effective, but do give a very good level of protection to the public. We've begun to see very good results among our seniors and other vulnerable populations thanks to vaccines.
Le résultat de la vaccination pour ces groupes prioritaires. Si on parle de la frontière, le Premier ministre a déjà constaté, ça c'est peut-être une autre question d'enjeu parce que c'est déjà, comme dit, quelque chose accepté qu'il y a des exigences.
It is well accepted that countries have certain demands, may require certain types of vaccine for visitors to enter their country. In that case, travelers need to show a proof of vaccination. And perhaps for tourists who wish to enter Canada,
c'est un enjeu actuel parce qu'on est en train de discuter, conclure avec plusieurs pays parce qu'il y a beaucoup des aspects, des normes, même pour l'aspect technologique, mais aussi des autres enjeux parce que ici au Canada,
technical standards and others that need to be met. Canada's vaccines have been approved, but there are other vaccines that have been approved in other Canadas. Are we going to accept someone who has been vaccinated with a vaccine that has not yet been approved in Canada? That is one question that we could ask. It's very difficult for me to answer a question concerning a single person, however, and the risk that this person would create for the general population. Perhaps Dr. Tam could follow up.
I think we have to recognize that I think the vaccines that we have, and certainly the ones that are authorized for use in Canada, look like they have a really good effectiveness, certainly against severe illness and deaths. And I think increasing studies showing that they also prevent asymptomatic and symptomatic infections. But there's not enough data on some other vaccines at the moment. So I think the data is looking pretty good towards the direction that vaccines probably do protect against a reduction in transmission. The extent to which they do that, is an evolving scientific study. but I do think that they can reduce transmission. I think it's looking that way, but we don't have the data for all vaccines. So I do think that there is a reduced risk potentially in those who are vaccinated. But if you kind of think about this situation another way, which is how much risk do they pose to Canada? So every layer is a layer of protection. They pose much less risk if the Canadian population has a high vaccine uptake, so that we can tolerate more potential risk of transmission from that perspective. So I think it's an interplay between getting our vaccines up and getting the rates of vaccinations up really high, so that we can potentially have people who come in who've been vaccinated, posing not just less of risk to themselves, but to each other as well. So that's another concept we're trying to work through.
Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam and Dr. New. Health officials have repeatedly said that all of Canada's approved vaccines protect extremely well against severe illness and death. But is that true for just one dose of a COVID vaccine? What immunity does one dose provide, and what should people know about the risk of contracting COVID as they await a second dose? And similarly, when will Health Canada provide guidance on what people with one dose and those who are fully vaccinated can do?
Yes, so there's increasing evidence that in real life data that one dose of vaccine protects very good protection against serious illness and deaths. And, even at a stretch interval, you can see that impact moving beyond the sort of 12-week mark. So that one dose is highly effective, but it's not as good as a second dose. So everyone who has a vaccine that requires a second two-dose schedule should get that second dose on the whole. And that will provide increased protection and also increased duration of the protection. And so you have seen, I think, how even one dose of vaccine has reduced long-term care, home impacts, and also, as we mentioned in our opening remarks on Indigenous communities that have received at least one dose of the vaccine, that it is an extremely important measure. But again, it's not 100%. So people should keep up with personal protective measures and observe public health advice in terms of what is going on in the community. We are also, of course, continuously monitoring any vaccine effectiveness studies against the variants of concern. And so we have seen that on the whole, most of the vaccines studied seem pretty effective against that B117 variant, which, as I've said, probably occupies over 90% or 95% of the variants in Canada. So that's good news. Even if it's slightly reduced protection, it looks pretty good. For the other vaccines, for the other variants, there's some data, but kind of limited, that suggests they may have a reduced protection against some of them. But they will still provide some protection. So the bottom line is still to get vaccinated. But I think our most important message is to be really clear to Canadians is that it doesn't matter whether you had one dose or two doses at the moment. Please observe all public health practices because we're in the middle of a big third resurgence, and that now's not the time to sort of let your guard down. But when the community is better protected and we protect each other, then we stand a much better chance to be able to lift public health measures with that resurgence.
Yeah, it's Dr. New. Maybe I just add a couple of points to what Dr. Tam has already, I think, covered very well. And that's the interesting, I think, the way you put the question in terms of sort of the mindset, right? Of course, at an individual level, you have a very good level of protection with one dose, and we've seen that from the real world experience. and the immunity is long lasting. And even with sort of an increase in dosing interval, you have even better protection after 2 doses. But rather than looking at what an individual could or should be able to do, after 1 or 2 doses, the way we're looking at it in Canada, which is similar to, I think, other countries like the UK, is more of a collective or sort of a population approach. So the fact that you get vaccinated is good for yourself, obviously, to protect you and your family, but it's also protect others in your community that you don't necessarily know, because it reduces transmission and so on. So at the end of the day, what we've been talking about is that maybe collectively, it's not about what you can or cannot do after 1 or 2 doses, is that, hey, let's look at your whole community. What is the vaccine coverage, for maybe looking at the potential an aspirational goal or something that will follow with the science. Maybe if, let's say, 75% of your community has received 1 dose, and then hopefully everyone is going forward and getting their 2nd dose, and you have a good level of sort of vaccine coverage for that 2nd dose as well. Then we'll look at the indicators, look at the extent of community transmission, look at hospitalizations, deaths, and so on. And hopefully, obviously, we anticipate that those indicators will be favorable as more and more of the population gets vaccinated. So I think maybe the other way to look at it is not guidance for what you can or cannot do after 1 or 2 doses, but what the whole community, what measures could be maybe be less restrictive as we all, as a population and community, go forward for vaccination. Thank you.
We'll take one last question before we end this presser. Hi, this is Teresa Wright from the Canadian Press. Just following up on your comments, Dr. New, you mentioned, and on Friday, Dr. Tam mentioned that 75% of people will need both doses before we can start easing restrictions. So just trying to get a better sense of what you mean by easing restrictions. And does that mean, for example, that Ontario and Quebec have to have both doses before we start seeing those restrictions starting to be eased?
So maybe I'll start. So the modeling that we presented on Friday is a tool for us to look at what could happen if certain parameters are met. And so we presented a range of different scenarios. Well, 2 of them we highlighted, but there's many ranges of scenarios. In one of the scenarios, it's where 75% of the population accepts vaccine together, and 20% of the population has received a 2nd dose. You lift at that point in time more restrictive measures in terms of these closures that you've seen, and any number of them, then you stand a chance for those measures to be lifted without a resurgence that can impact your health system. So we looked at one aspect of the impact of the pandemic, which is on hospitalizations. Because right now people are concerned because the hospitals are severely impacted, ICUs are full. So when you get to that kind of level of vaccination with a whole bunch of assumptions built in about how effective these vaccines are, what the variants are doing, and whether we got this 3rd wave under control, that will be a time to examine whether we can really ease those restrictive measures while keeping up with the layers of personal protection and the testing and contact tracing. That would be a sort of a scenario that we can aim for. But those scenarios can be adjusted over time, but it gives you an idea of the kind of levels of vaccination that we need to strive for, so that when you lift these measures, you're not back into a resurgence again. That's going to overwhelm your health system. For now, everyone's focus must be to flatten this 3rd wave, and don't let go sort of halfway, 2/3 of the way, get those numbers down. Then we have a chance for the vaccine to take effect and be able to test and trace and contact trace the smaller number of individuals then that gets infected. And so then you stand a chance of lifting measures without having to come down to another of the more restrictive things that we're seeing right now. So that's the idea of the model that we did on Friday, but we'll certainly provide updates as we have more real life data to feed into them.
Thank you. It's Dr. Maybe just to add a few more bits to what Dr. Tam has said. Yeah, for now, obviously, we're in the third wave, and certainly many regions, areas in Canada are certainly very, very stressed in terms of the healthcare systems, the number of cases, and so on. And you can see that there are even more, but say, restrictive or local measures. For example, I think I'm aware of what's happening in Peel region in Ontario, where they're looking at what might be the threshold in terms of looking at let's say businesses and what should happen should there be 5 or more cases in the workplace. So those are the kind of local sort of measures based on local epidemiology that's very important as we move forward. So as Dr. Tam said, the public health measures, the personal protective measures, we need to keep at it for now. But I think what I think is hopeful, is the fact that we've seen a lot of, interest, and obviously you folks in the media as well, about sort of looking at the 75%, I think a good objective in terms of vaccine coverage for 1 dose, and then 20% for 2 doses, and so on. And I think what that indicates is that that's something to look forward to. That I think the news is very encouraging that more and more Canadians are going forward to get vaccinated. So I think in a healthy way, if it's sort of maybe even a competition between provinces, hey, let's see what our vaccination rate is this week and the number of doses administered compared to our neighboring provinces. I think that's good for all of us, because then as more and more Canadians get vaccinated, we'll have sort of a closer sort of attainment of the vaccine coverage we're looking for, and then we'll look at the data. And rather than, as you put it, like what can Ontario and Quebec do, I think probably, I think as the vaccine coverage goes up in various parts of the country in specific areas, it might also be at the local level that we'll see what type of measures could be maybe be less restrictive based on local epidemiology and the impacts of vaccines, along obviously with sort of the good adherence to public health measures as well. Thank you.
Thank you, Dr. Tam, Dr. No, and ministers. This is what ends today's presser.